Today's Good Health segment is brought to you by Horizon Health. Did you make some New Year's resolutions to try to feel better this year? Well, you're going to have to know about your overall health, and there's a good chance it starts with an annual physical and an array of testing that your doctor will order. Here to discuss the 4 most important tests that you should be paying attention to and what those results mean is the president of the College of American Pathologists, Dr. Donald Karcher. Doctor, welcome to Good Day Live.
Thank you, Julie. Thanks for having me.
So let's talk about these 4 most important tests that patients should pay attention to, can we?
Yeah, absolutely. So maybe we don't all get an annual physical, although it's a good idea to do it, and may not get these tests every year, but there's a good chance at some point your doctor will order these tests, so we think it's important to be aware of them. The top 4 are glucose, cholesterol, vitamin D, and a test called EGFR, which is a measure of kidney function.
So why are these particular tests so important for us to monitor?
Well, these tests are used by your doctor to monitor a lot of different things about your health. 3 of them are usually part of a panel of tests that are ordered periodically to check on general health. One of them, vitamin D, isn't ordered as often, but if your doctor suspects that you might have a deficiency, your doctor would consider ordering that. One of them, glucose, is very important in detecting diabetes or pre-diabetes. The other one, the second one, cholesterol, is important in identifying possible lipid disorder. If a person has a high cholesterol, they're at risk of heart disease and also blood vessel disease, such as atherosclerosis, fatty plaques building up in the arteries. If your cholesterol is high, your doctor will very likely order a more extended panel of lipid tests called a lipid panel, and that helps your doctor determine what might be causing the cholesterol to be high and whether or not your high cholesterol is all bad cholesterol or possibly also some high good cholesterol. The nice thing about these 2 tests is that there are things that we can do without necessarily medication, such as eating a better diet, getting more exercise, maybe losing a little weight, to keep these values closer to normal.
So you mentioned that vitamin D level, which I find interesting because I recently had mine tested. Believe it or not, doctor, I had too much. So apparently I was going crazy with the vitamin D. But why is that level so important?
Yes, well, vitamin D, not always ordered as frequently as the other tests, but vitamin D supports bone health and healthy muscles and other healthy functions in the body. It helps to keep the calcium level in the blood where it should be, which supports, again, our bones and muscles and other functions. We sometimes call the vitamin D the sunshine vitamin because one way to get it increased is to spend more time in the sun. The UV light in the sunlight actually converts a precursor in our blood to the vitamin D. We all use sunscreen more often than maybe in years past, and also during the cooler months, we all spend less time in the sun. So vitamin D deficiency turns out to be more common than it ever has been in the past, particularly in the cooler months of the year.
And about that EGFR test, what are the changes that we would look for in relation to kidney disease?
Yes, this is a test that monitors and measures how well your kidneys function, how well your kidneys remove waste products from your blood. Kidney disease, particularly early kidney disease, may not be associated with any symptoms at all. So the results on an EGFR may be the very first indication that a person might have kidney disease. There's been an important change in how this test is calculated now. It used to be that a formula that took race into consideration was used. It was realized that that's biologically inappropriate. And so now, over the last 3 years, there's been a movement to get away from that old formula and to use one that no longer uses race as a factor. The EGFR level not only helps your doctor detect kidney disease, but also helps your doctor decide how to manage kidney disease and whether or not you might qualify for a kidney transplant. So it's obviously very important for that test to be as accurate as possible. I'm very proud of the fact that the CAP, my organization, has taken a really active role in making sure all laboratories are using the proper non-race-based formula for this test.
Well, you've shared some great information today. If our viewers want more details, where could they go to get that?
So lots of good websites out there. One really good one we think is yourpathologist.org, where you can learn about a whole range of different tests that you might have run, and that how a pathologist might be interpreting those tests to support your health.
Some very good information. And here's some more for you now from Horizon Health. They're offering a free Heart Saver CPR AED course Tuesday, February 6th from 1 to 3 at its education center in Paris. The course will teach basic CPR and the use of an AED. Obviously, these are both very important. An official CPR AED certification card from the Heart Association is optional if you want to pay $25. The course does not include first aid. That has to be arranged separately. If you want to register, you need to do so at myhorizonhealth.org/classes. You will be required to give a credit or debit card, but it will only be charged the $25 fee if you register for the class, but don't attend. Stay with us. We'll wrap up today's show with a great Friday freebie.